pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
Thank you. Please be seated. Item number 2 is the invocation. For that, our friend, Dr. Mark Towns. Welcome, sir.
Thank you, Mayor, council members, and city officials. Thank you. I'm here tonight with my youngest son, Nathan. He's a 7th grader at Creekview, and very thankful to be in the community with you, and certainly glad to be here tonight. So would you join me in prayer? Merciful Father, we come before you with grateful hearts. We thank you for your blessings poured out upon us. For Father, we recognize with every breath that we are reminded of our need for you. And Father, I pray tonight for this council, for our mayor, for our city officials, for all those who take on many times the thankless and difficult job of unifying and bringing together a city around common goals. Father, I pray that you would remind them that they are thought well of, that they are prayed for, and that we support them. Thank you for the opportunity to be a community that really aspires to neighbor one another well and to live in community and to be a beacon to other communities around of the good things that are happening here. In addition to the economic and the infrastructure and all the different growth and things like that, Father, that there would be a prevailing message that comes out of this city of Training Grain, that there would be a light and a reminder of what it means to be a people who respect one another and love each other and help and look after one another. And I pray that you would continue to protect that you would your divine protection would be upon all of our residents, that you would continue to empower the police and fire and the first responders and watch over them and those that need their attention desperately. God, we come before you in this season of spring and give thanks for the beauty of creation. And I lift up this night to you and pray that you would guide with wisdom the decisions that are made and the things that happen in this chamber. And we pray in Jesus' name. Amen.
Amen. Reverend. Item 3 is audience participation. If there is an item on the agenda you wish to speak about, please see the city secretary and fill out a brief little form, and we are glad to speak. You're only allowed to speak on items that are on the published agenda. Moving forward, item number 4 is the consent agenda. A is action regarding minutes of March 7th. B is action regarding joint election agreement with Tarrant County. C is action regarding purchase of police cars 2021. D is action regarding retail retention, recruitment, and development services provided by the retail coach. E is action regarding resolution number 2023-06, participation in Texas Smart Buy membership program. F is action regarding resolution 2023-07, authorizing city manager to execute the global opioid settlement document. And G is action regarding East Cement Creek Channel reconstruction phase 1. Any questions, comments, concerns on the consent agenda?
Mayor, I'd like to pull item D and F.
D and
Please.
F.
Thank you.
All right, any other questions, comments? If not, I will entertain a motion on A, B, C, E, and G.
Mayor, I make a motion that we approve A, B, C, E, and G, please.
For a second, please cast your vote. Motion passes. Let the record reflect we do have a quorum, a full house tonight. Thank you for showing up, folks. Moving to item D, action regarding retail retention. For that, Director of Community Services and Economic Development, Keith Reinhardt. Keith?
Thank you, Mayor and Council. We have worked with, I took over economic development in January of 2020. We started working with Retail Coach in March of 2020, right when COVID happened. We used them to do retail recruitment for our city. We've been behind just because of not having the economic development department for a long time. And we've worked with them, and what they do is they don't work with Chamber of Commerce, they work with cities, and they work with cities only to recruit businesses. I do a significant amount of recruitment myself, but they have the ends. They can get me in to them, to the right people. They have the contacts that it's hard for me to get. They have that information. One of the things that you approved as a council back in earlier last year was the local favorite development at the fire station. That was a work item that y'all asked for to be for us to find one sit-down restaurant in replacement of what was on that facility, and what we brought you was 3 sit-down restaurants and an entertainment venue. How that happened was I happened to be at a conference that they were at also, and they got me in to talk to them, and we had a 20-minute meeting with the CEO. That's how it happened. That never would have happened had we not been able to do that. I also have, if you got the time, I've got a 10-minute presentation, I've got the elevator speech, or I've got a 30-minute presentation to tell you all that Retail Coach has done for us, including improving our sales tax revenue. Any questions?
Questions, council?
Yeah, one of the questions that I had was, is there a time where you could have Retail Coach come in, or you give them the presentation of what they've done for us like they've done in the past? It's been a while since we've had one. And,
sure, we can do that. One of the things I mentioned in the last, I've been asked quite a bit over the last 3 months to do presentations to different groups in our city and outside our city about economic development of Saginaw, because we're in the buzz. People know who we are now, and I'd be glad to do a work session with you to talk about everything that's going on in economic development, or we could have Retail Coach, either one, or both. Anytime I can talk about what I do, give me a mic.
And you're good at it, and we appreciate it.
When was the last time we had Retail Coach in? I don't remember.
Probably probably a year and a half at least.
Maybe it's time to have him back.
That's why I'm going to ask.
Yeah, let's reach out and see
Sure.
when we can come. And
I'll
you
set it
can
up.
add to it as well, but we'll have both. Sounds perfect.
Yeah.
Any other questions regarding D?
I had one more question.
Okay.
I was looking at the financial impact, and it says plus reimbursable expenses. What does that normally run a year with them?
We've never had one. What it could be is if we ask them to come in on a specific day to speak to us, if he's not already planning on being in town, because he's based out of the Austin area, if he's planning on being here anyway, then he doesn't charge us. But if he's not, he has to make a trip, and then there could be charges for that.
Okay. I didn't know if we, paid for his fees at these conventions that you go to, or if that's split among
All of that is
that covered?
anything and everything that they do for us is covered in that agreement.
Okay.
An agreement. The only addition would be is if they had any extra expenses, such as coming here to speak.
Okay.
Type of thing.
Thank you.
Anytime they represent, they're able to do what I can't do. I'm a one-man show in economic development, and there are a large staff based out of Mississippi and Austin. And what they can do is they attend a lot of conferences that I don't have the money to go to, that are out of state and even in state, and they represent us, which is huge.
Oh, and they have one hat. You have about 25.
I have 25. Last count.
All right. Thank you.
Any other questions on D? All right, now moving to F, action regarding resolution 2023-07, authorizing the city manager to execute global opioid settlement documents. I guess that's Brent?
I'm the liaison for this, but obviously the Attorney General's office is spearheading this movement. They brokered these settlements. You all may recall several years ago you entered into your first settlement for the essentially the ill health effects and cost burden associated with the opioid epidemic. So the state attorneys general have sued manufacturers, distributors of opioids for negligence, essentially, in their distribution and manufacturing of the drug. So just to give you a little bit of background, and I'm going to refer to my notes here, I apologize. So this particular settlement will require Allergan to pay $135 million, CVS to pay $304 million, Walgreens to pay $340 million, and Walmart to pay $170 million. So those only a small percentage of that is distributed to the municipalities. So it's impossible to give you a precise amount that's going to go to the city of Saginaw, and it will be distributed over time. But the current estimate is approximately $30,129 to the city of Saginaw. And there's no legal costs associated with that, but we do need to approve these settlements and make sure that we timely respond to the Attorney General so that they have the resolution that's here before you this evening. And with that, I'm happy to entertain any questions.
So this is a done deal? The settlement has been made?
So we have the option to opt out, and then we won't participate in the settlement, and then that would give the city of Saginaw the right to sue these companies directly. But obviously, the cost burden associated with that makes it.
But the settlement has already been ordered by the judge?
That's right.
Okay.
Yeah,
We're
not a party to the suit, so the state of Texas, through the Attorney General's office, sued these companies and brokered the settlement, so the settlement is a done deal.
Okay. All right. Thank you.
Other questions on F, council? If not, I'll entertain a motion for D and F.
Mayor, I make a motion that we approve D and F on the agenda as presented.
Second? Sandy, second? Please cast your vote. I just wrote that one. I don't forget this every time. It took me a while. Did we pass? Okay, we passed. Motion passed. All right, thank you. Moving forward, item number 5, proclamation for Child Abuse Prevention Month. And Mayor Pro Tem will read that.
Is Lindsay here? Whereas children are our future and our greatest resources, and whereas every child deserves a nurturing family, a safe environment to grow into a healthy, productive member of the community, and whereas child abuse is one of our nation's most serious public health problems and threatens the safety of our community, whereas in Tarrant County, 5,506 children were confirmed as victims of child abuse or neglect in 2022, and whereas Alliance for Children provided trauma-informed services to 2,434 children in 2022, whereas finding solutions to prevent child abuse in a community is a community's responsibility and depends on the involvement of all citizens, and whereas effective child abuse prevention, investigation, and treatment programs succeed because of partnerships among public and private agencies, schools, religious organizations, medical services, and the business community. Now, therefore, be it resolved that you, Todd Flippo, Mayor of the City of Saginaw, Texas, do hereby proclaim the month of April 2023 as Child Abuse Prevention Month in the City of Saginaw, Texas, and urge all citizens to work together to help reduce child abuse and neglect significantly in the years to come.
Thank you so much.
I think we have a representative, so introduce yourself, please. And
Sure, thank you. This is actually my second year here accepting this proclamation, and Saginaw is near and dear to my heart. My daughter attends Wayside Middle School. So my name is Lindsay Price. I am the Team Relations Supervisor at Alliance for Children. First, I just really wanted to thank you for acknowledging April as Child Abuse Prevention Month in Saginaw. We are very grateful to work with this city and to partner with your police department. Very excited to have Chief Ragsdale over here. We've apparently worked together long time. I've been with this agency for 15 years. So we also are just super blessed to work with Saginaw Police Department, and through collaborating with a teamed investigation approach, we are able to more effectively and efficiently support our children in this community. We also wanted to thank you specifically for the financial support y'all provide to us. We could not do what we do without it. We are able, with y'all's financial support, to provide teamed investigations, forensic interviews, case management, investigation coordination, trauma-focused mental health for our children and families at no cost. Everything we do under our roof is absolutely free. And it is directly in relation to your steady and dependable support. So while we all long for the day when child abuse is eradicated from our community, please know that until then we are ready and standing here to protect and serve our children together. Thank you.
We want to get a photo? Mayor Pro Tem wants you to get a photo.
Chief, will you go? Sure. And can you also?
All right, item number 6, presentation of the 2022 Economic Excellence Award from the Texas Economic Development Council. It says me and Keith. I think Keith's going to run this, right?
I'd rather not, but I will. As someone, I consider myself as a servant leader, so I don't like to talk about myself. I like to talk about the good things of others. Unfortunately, I just have a staff of one, so I'm going to refer to it as my staff. We received an award from the Texas Economic Development Council. This is the third year we've received this in the last 3 years. Awarded to the city of Saginaw for basically how we run our economic development department, how we do things, how the improvements we've made, the policies we have in place. We've been recognized by TML. While we did not win an award, we were a finalist. We're one of 3 in the state of Texas. The award's just in recognition of how we do business, in a nutshell.
And Keith is way too humble. Since Keith took this over years ago, I mean, I've been on council way too long. Years ago, we dipped our toe in economic development, and we didn't do very well. We tried a few things, didn't work out well. Once we really made a commitment, and that really began, when we got Keith involved, really jumped into this hard. We had a relationship with other folks that just wasn't as effective, and Keith, we always mention he wears a lot of hats, and that's true, but the one he wears very well is economic development. I don't know if he realized how good he was going to be at this and how well he was. He's just the kind of person that works well with this. He's got good relationship skills. He knows the city. He loves the city. And we've made tremendous strides. I cannot emphasize what kind of strides we've made since Keith has been involved. It's been amazing. And things are just now starting to break. As Keith mentioned, you've got to work it a while before you start getting some of these seeds to sow and start to grow, and some things are going to grow in the next couple of years. We're going to see some really cool things come to Saginaw that we have not had before, and that's hugely because of Keith. So my hat's off to you. I appreciate it. This is well-deserved. It is a suitable for framing plaque. Very nice.
I think you need a picture with him.
We probably do, don't we?
One of the tough.
But thank you so much,
We
Keith.
do that. One of the tough things about the job is that I've got to keep secrets. Basically, and the reason for that is when businesses come in and they're looking at going to a certain development, if they're serious, they sign a letter of intent. Now, think about college football or college basketball and athletes who sign letter of intent. I'm going to go to the University of Oklahoma, Randy University. But then when it comes to signing day, they have those three or four hats sitting up there, and they grab a different one, and they put it on. Randy gets really sad, very upset, heartbroken. He doesn't come to work for a week. But letters of intent mean nothing until they sign a contract. And there are a number of letters of intent that are signed right now for some of our developments. I just can't say anything until a contract's signed. But when they are signed, you're going to be blown away.
Item number 7, MedStar presentation, State of EMS and MedStar. For that, Fire Chief, Doug Spears.
Thank you, Mayor Flippo and Council. Kind of repeating what I wrote in the agenda cover letter, although political rhetoric dominates the national news, sometimes at nauseating levels. If you watch in any recurring frequency, you've likely saw stories of EMS struggling around the country, primarily ambulance service and hospitals. Ironically, insurance carriers seem to be doing okay, but even parts of our own state are struggling with EMS and potentially losing services. Our partner entity, MedStar, is not immune to the concerns and challenges being faced across the country. So with that, we have MedStar CEO, Mr. Ken Simpson, with us, who will give us, as you said, a state of EMS and MedStar.
Good evening, Mayor and Council. Thank you, Chief Spears. Before I get started in this, I want to just kind of outline it has some down points to it. This is not the end of days. You will continue to have an ambulance service here. It is, as Chief Spears says, it is a very serious thing, and as they say, changes are coming one way or another. And so this is just to kind of provide some education and insight into what's going on nationally. And here, the advantage we have locally is, as you all probably know, Chief Spears sits on our board of directors. And we have a very strong collaborative group that's been working hard on solutions to try to address and remedy some of these things. But I want to explain to you all a little bit about why we're seeing the struggles that we're seeing both here and nationally. So as I was looking at the title slide, I was like, I should probably explain that before I get into, with the little guy on his intubated and everything. So we have had a lot of articles pop up since early in COVID about the struggles of EMS, and it's all kinds of EMS. It's fire-based EMS, hospital-based EMS. They have third service that cities have just a strictly EMS department. Private providers are also struggling. AMR is one of the largest ambulance providers in the country. They have recently closed down their Dallas operations, as an example. Out on the West Coast, there are several others that are large nationally and internationally that have closed operations because of some of the struggles that they're having. And these struggles are driven a lot because by both the expense side of it, medical supplies have gone up. You all may have noticed fuel has gone up a little bit in the last few years. Employee expenses have gone up, salaries, inflation, all that kind of stuff. Like Chief Spears says, the interesting thing is the reimbursement doesn't seem to go up. A large portion of what we receive to run the ambulance service and the mobile integrated health side is governmentally funded from Medicare and Medicaid. Medicaid itself has not done an increase since 2007 in rates. Everything else has gone up a little bit since then. So that presents somewhat of a challenge. We actually started with some of the other ambulance providers nationally, tracking some of the articles that came up, and that's kind of what this Excel sheet shows here. Through that, you'll see a lot of different articles about the challenges that different parts of the country are experiencing. 61% of them focus on the staffing challenges overall, and it is not even just in this country. London EMS, it's probably not something you follow very much unless you're in the business. It is literally falling apart. People are waiting 3 and 4 hours on ambulances when they're having heart attacks. And much the same challenges. There's a little bit of a backstory to that, but again, it's staffing challenges and expense challenges and just supply chain issues that they're running into with this. We'll kind of unpack some of these things as we go through the presentation here, and we'll start with the workforce challenges with recruitment and retention. Historically, EMS wages have been lower. Again, there's been a lot of reports about that in comparison with other public safety entities. We have increased since 2020, we've increased our paramedic wages by about 50% during that time, just to try to attract and retain people because the competition has gotten so fierce. one of the challenges is healthcare in general is experiencing staffing shortages, and yes, sir.
Can you tell me what the difference between an EMT and a paramedic is?
Yes, sir. An EMT is trained and educated for things like bandaging and splinting and basic life support. They're taught CPR and AED usage and sort of immediate life-threatening or life-saving interventions, not life-threatening, if they do the education right. Paramedics are taught to read EKGs like heart monitors and things like that. They can provide cardiac drugs. Paramedic school's typically about a year to a year and a half, depending on the school. EMT school's typically 3 to 4 months.
Okay.
So
Thank you.
Paramedic's a higher level certification.
Gotcha.
Sometimes I use too many words. So, but anyway, as I was saying, the healthcare community in general is also experiencing a shortage in nurses and whatnot. They've realized that paramedics can be used in hospitals, and hospitals and healthcare entities typically have deeper pockets than EMS providers of any sort. So we're facing that as well. And then throughout the pandemic, we saw a lot of people start to leave the healthcare industry in general. They got into different fields. There are a variety of reasons for that. These are national statistics from a couple of years ago. They've actually gotten a little bit worse. But you see total turnover somewhere in the 20 to 24% range. Nationally, MedStars is a little bit less than that. Last year we came in about 23%, I think, turnover. And there, as I was talking about, 47% of those that responded to the survey were actually leaving the industry looking for other opportunities that was a little bit more fulfilling. So it sort of begs the question as to why they're leaving. People get into the industry thinking this is what they're going to be dealing with. A lot of excitement, people pulling people from the jaws of death, pulling them back from, death and dismemberment. And this is what their day actually looks like. What this is on the right-hand side, when I was putting this presentation together, I literally opened up our computer-aided dispatch screen, and I just copied the chief complaints off of that. It is not cherry-picked in any way. There are some serious complaints on here, but you see one, need help going downstairs to get on the bus. I'm constipated for 3 days. I fell and hurt my foot on the door. Since Christmas, my arm hangs and I'm having soreness. And, it's when we got, this has been around for a long time. I'm a paramedic. I worked on an ambulance. I'm sure Chief Spears did. Maybe he had to hitch horses to it. I'm not sure. But it was just part of the job. It's one of the things that we did. And the younger generations that we're recruiting, they want more. They want a sense of purpose. They want to feel like they're contributing to a greater good. And, and we see that there's tons of different examples. I just pulled this one off of the internet as far as, generational differences and what's important, flexible schedules, and having that sense of purpose in what they do. And as the folks, we do exit interviews as people leave, we do face-to-face exit interviews, and a lot of what they talk about is just the abuse that goes on in the 911 system. In the way that the system is structured today, if somebody calls 911, we send an ambulance to go see them, regardless of what it is. We do some things differently than a lot of other places, but we're still sending an ambulance to go see them. And if you're a 19, 21, 22, 30-year-old person that thought you were going to be in there pulling people out of the jaws of death, and you're going to take care of the person that has been constipated for 3 days, it can be a little bit disheartening. So, and what happens is then people leave the industry and they go find other things to do that may pay better, that may offer more flexible work schedules, more work-life balance, things like that. We used to do mandatory overtime also, where we mandate people to pick up extra shifts, and again, they'll just leave. And it's not just us. We talk to people of all different services, fire and third service, and people will literally quit these days. And so the ones that are left, these are flyers, just screenshots we took from the last year of competing medical providers. You see Last year, Grapevine Fire Department was doing a $10,000 hiring incentive for paramedic firefighters, and their starting pay, I think, is somewhere in the 70s. Plano, they advertised a 2-year top out at almost $100,000, and they're in the middle. I forget who it is, but anyway, they're advertising for folks starting at $86,000 a year. So the salaries just continue to go up higher and higher to work those kind of schedules. Austin, Travis County, they just increased their paramedic pay to $33, just over $33 an hour. So, and then, as I mentioned, hospitals have realized they can hire paramedics also. This is one of the postings from THR, and we have a great working relationship with THR. I'm not mad at them for stealing my employees, although I harass them about that frequently. They offered an $8,000 signing bonus at $48 an hour. It's seasonal work, but still, people will leave for that kind of money. So, kind of the cost challenges we've seen over the last year. Our ambulance costs, we did an RFP and we signed a contract to replace all of our ambulances over about a 5-year period. The manufacturer came back to us about a year ago and said, hey, we can't build the ambulances for what we contracted. And we need, I think it was about a 16% increase, 16 to 20% increase in the remaining ambulances. I actually went to law school, and I told them, I said, I have a contract, and I'm pretty sure at the beginning of law school, they said the purpose of this is to hold you accountable to the terms of it. And they said, fine, we just thought we'd ask. I'm still waiting for ambulances. So we're probably going to have to take some steps that we'll be talking to the board about to address that. But regardless, in the meantime, I've got to have ambulances, so I have to step out and remedy their shortfall, I'll say. But there's been about a 25% increase in the cost of ambulances. As I mentioned, fuel, and this is another one of the national studies done by NAEMT, and NAEMT is a trade organization, I'll call it. And there's all different kinds of providers. They're not just strictly EMS providers in that. They're fire-based and whatnot, and third service in privates as well. So, but medical supplies costs have gone up ridiculous amounts, 25 to 50%, depending on what you're talking about, the stuff that goes on, that we actually stock on the ambulances, and then all the equipment. An ambulance today to put in service, fully stocked, is about $350,000 plus $1,000, and we've got around 80 of them. So. Again, through NAEMT and Public Consulting Group, that organization is an independent party that does cost projections. In other words, we send all our information to them, as do all these other entities, and they compile it so that it's accurate. Nobody has any questions about whether somebody fudged numbers or whatnot. But there's been, you can see there an 11% increase from 19 to 20. And then from 20 to 21, there's another, depending on which line you're looking at, 0.25% increase in the cost of services, and there'll be another larger one this year as well. So, and then we've talked a little bit about the insurance companies. The majority of our reimbursement does come from government payers. The deal with government payers is I can bill them whatever. I can bill them $1 million. They're going to pay what they're going to pay, and they prohibit billing anybody else for that, which is fine if they kept up with CPI or the cost of living increases. And unfortunately, they have not done that. And in the past, we would increase rates because commercial insurers would typically pay more than the governmental payers would. We've seen the commercial insurers decrease over time because of that. We got notified the other day that the VA, and starting in 2024, they were changing their reimbursement model. We are engaged in discussions with them about this on a national level. The EMS industry is. But just for MedStar, if they make the changes that they're talking about making, it would mean a decrease of $1.7 to $1.9 million in revenue for us. Apparently, that's a large enough number that the federal government is not quite sure that the VA can make it on their own. So we're working on putting that together. But across the board with all the payers, these are the issues that we're running into, is it's just not keeping up with the costs. And in some cases, the patients end up getting caught in the middle, because if they have commercial insurance and the insurance provider won't pay, the patient ends up getting a bill and they end up arguing back and forth. The challenge with EMS is we've done a really effective job at teaching people to call 911. And, some of the complaints I put up there are a little bit humorous in the fact that people would call. There are a fair number of people that call because they get really frustrated. Navigating the healthcare system is difficult. My family, my grandparents they owned restaurants coming up. It's where I worked growing up. They are to an age now where they're having to access the healthcare system, and you talk about frustrated. They luckily call me instead of 911, but they don't understand what pre-authorization is. They don't understand why, they've been married 67 years, I think, and my grandmother's had cancer and things like that, and for my grandfather, watching her be in pain and not being able to get the care that she needs is heartbreaking for him. So people will call 911 for that reason, and we'll send them an ambulance and try to help them navigate through the healthcare system because of that. But, the challenge is the expenses have increased. It's become more and more difficult to do that. For MedStar specifically, over the last 2 years, we've spent between $2 and $4 million in excess of what we've brought in. So we've been burning savings at that rate. And luckily we've been.
I got a question.
Yes, sir.
Okay, so I seen your thing at that. How many of the calls that you all get called out for are for these non-emergency things?
A huge percent. Let me answer the other side of this. For life-threatening calls, somewhere between 2 and 5% of our call volume are truly time-sensitive, life-threatening calls. Another 20 to 25% probably could be considered emergent in that they need an ER. So the other 75% can be dispositioned.
So 75%. So
rough numbers.
Okay, understand that, man. I'm just sitting here trying to think. So and I'm definitely, this is out of my wheelhouse here, but I'm just sitting here thinking, is if 75% of them are people who's constipated or they don't know how to get pre-approved, when they call 911 and 911 asks them what's their emergency and they do that, why can't we set up send them over here? I mean, it seems like to me, if 75% of my cost is due to that, with the smart minds that we have, should be able to put together a thing to say, okay, when 911 calls in, what's your emergency? Well, I can't figure out how to do this. We could send them over to a help desk or something, somebody to help them, or even send somebody out that is not EMT. You could hire a person who's just good at filling out the paperwork.
Did you read ahead?
No.
Oh, okay. No, those are things that we're discussing. And those are things that we're looking at, and those are things that we've done in the past. There's still obviously an expense with that. It's not $350,000 for the ambulance and that sort of stuff. It is less expense, and as we're having discussions about more cost-effective ways to do it without necessarily trying to match up the revenue, those decisions are coming more and more to the forefront of how we have dealt with that. We've done a nurse triage program before, and that can divert about 10% of our call volume pretty easily, we think. And what that does is essentially what you're saying. The nurse listens to him and says, hey, I'm going to send you a lift to take you to an urgent care, or I set you up a doctor's appointment tomorrow or Thursday, and I'll even arrange the transportation for you. And rather than paying $400 or $500 that it costs us to get an ambulance, and that's not even counting what it costs the city of Saginaw to get a fire truck out there with the folks on it, we spend, say, $50 or $75 on that.
Right.
So those are options we're looking at. The other thing I will say is those who want to abuse the system are very good at abusing the system. They will call and say, I've got chest pain, because they want an ambulance to take them down to the hospital where they can get a free snack pack or get in out of the cold or the hot. But your point is well taken, and those are things we're working at. There is not a be-all, end-all solution to it, but I do think that that is part of the solution. You want a job? So actually talking about that. Some of our delivery challenges that we've talked about with this NAEMT group and gotten feedback on things that the systems have changed. Again, ALS care is a small percentage of the patients that we actually see. So a lot of services across the country, us included, with the First Responder Advisory Board and the EMS System Performance Committee that Chief Spears is part of, we've done things like increase the number of BLS ambulances, so 2 EMTs that are at a little bit less cost on an ambulance to better match up the kind of service that they're getting with what their actual chief complaint is. Because if you're not having a heart attack, you probably don't need a paramedic, and paramedics are a little more difficult to come by also. Some of the systems have lengthened some of the response times. Once again, if it's a low acuity call, well, you saw the person that had been arm numbness since Christmas. That's 3 months. So lengthening some of the response times may be an option, and alternative response to low acuity calls, which is what you're talking about with nurse triage and having outside people come in to help intervene, are some of the things that they've done. This next slide is just some of the other EMS providers that are part of this AIM High group that we participate in. They're high performance EMS systems, and you see some of the conversation about changing some of the response time goals and utilizing nurse health lines and things like that to help meet some of that. And then the next table is some of the response time changes. You see some longer response times there. The challenge, as you all might imagine, if you think you're having a medical emergency, there is some sort of expectation there that you'll get an ambulance quickly. Again, the stuff we went over is pretty obvious. Those aren't medical emergencies. Sometimes people think, hey, this is an emergency. If they wait 25 minutes on an ambulance, you all may get a call. So that involves this community education and conversation and making, if that's the road that we were to go down or one of the roads that we were to go down, making sure that everybody understands what that looks like, making sure our call center is equipped to explain to people that, hey, this isn't a time-sensitive medical emergency and we're going to get somebody to you, but it might not be an ambulance and there are more acute people in front of you, and preparing you all that if that happens, you may have constituents call that say, hey, my ankle really hurt and I was crying and it took them 30 minutes to get an ambulance to me. But those are, we kind of laugh, but it happens.
That's no different than the way the hospitals, if you show up to the hospital for a true non-emergency, again, that sprained ankle, you're going to be sitting in that waiting room quite a long time.
I often tell people, I think most people have probably read stories about somebody that got picked up and taken to the hospital, dropped in the waiting room, got tired of waiting after 3 or 4 or 5 hours, then they got a $700 bill because they left without being seen, and people get all up in arms. I can't believe the hospital sent a $700 bill. My view on that is a municipality somewhere paid millions of dollars to get them an ambulance in 5 minutes to take them to the waiting room. Yeah. Wait for 4 hours, left without being seen, and that patient was still well enough to talk to that reporter about the $700 bill they got. Yeah. We have to, the system is pushing us towards having to be able to have some of these difficult conversations, and the reality of the situation is there are truly life-threatening conditions that are going on. We have to get to those conditions first, and if it's not life-threatening, we want to try to help you get the help that you need, but it might not come in 5 or 8 minutes or less. And that is some of what we've done. We went through something we called reprioritization to really try to group those life-threatening calls at the top so we could really recognize them. We looked at 3 years' worth of call information and said, hey, based on essentially statistics out of how we triage these calls, we call them emergency medical dispatch codes, which ones have the highest likelihood of getting intubated or having electricity to defibrillate your heart, these high acuity calls, and it's about 2.5% of the calls. But those are now our priority 1 calls. We started this on March 1st. Overall, it's worked pretty well. As we've talked with everybody, it is statistics, and any way you cut it, there's a chance that somebody will fall through the cracks one way or another. You put everything in priority 1, you're going to be out on constipation when the person's actually having a life-threatening emergency. Doing it the statistical way, there's a small chance that somebody may get grouped into a lower criteria, but we do run as a first response system, and there is that opportunity for the first responders to get there and upgrade the ambulance if it ends up being something higher acuity. So, like I said, I don't think that there's a one-size-fits-all approach. This was kind of the first step in what we're doing. And that's what this talks a little bit about, the ALS to tiered response, right resource, right patient. Those are some other things that we're talking about, is actually putting physician assistants in the field in what we call fly cars. They're SUVs with single providers, putting paramedics possibly in fly cars with single providers, and having the ambulances be BLS. It allows us to really diversify what kind of resources we're getting. And again, instead of sending a big expensive ambulance that gets, 3 miles a gallon, putting them in a Ford Explorer, something like that, that's a little more fuel efficient and more cost conscious is important. The reprioritization I just talked about, our big focus with that, if there's a group that we want to make sure we get there quickly, it's these high acuity patients. The truth of the matter is many of the rest of them do not matter. They aren't going to get worse if it were to take us 20 or 30 minutes to get there, because it's just not time sensitive. And so taking the time and allowing a little bit more time to get resources to them is important, because time, quite frankly, time costs money. The cost of readiness is very expensive, and that's some of what we're running into. So we group that out into 9 priorities, where we used to have 4 before. 8 priorities are basically just tiers of severity. So, so we did. And then I talked a little bit about the PA, the potential for PA programs, and some of the different single response providers that we're looking at evaluating there. So the big take-home messages that I want you all to take away from this is truly an international problem. It is literally in any state you can look at. There are providers that are closing up. Everybody's struggling, trying to figure out how to get the help that they need and make it rewarding and make it places that people want to stay. The economics has changed significantly. The federal government is paying close attention to this. Our chief transformation officer is going to be at a federal roundtable with basically the Medicare office and some folks from the White House about how to address this. But it's government, big government, so change takes time. But it is big enough that it has those folks' attention. The supply chain makes it very difficult. The cost of equipment, the cost of medical supplies and things like that is expensive. We have had internal cuts to some of the things that we had in the past. We have left positions on field to try to be more cost conscious here at MedStar as well. There may very well be a solution that we come up with that offers a lot of the different varieties that we're talking about. I want to be very clear that there's a fair chance that at least for a period of time, there will be additional dollars that will be needed to help support the EMS system. And that's one of the other big sort of takeaways with that. I'm not in a place today where I can say anything about what that dollar amount may be or whatnot, but we do want to make sure that gets put on the radar as well. But know that as we're going through this, both our board, over the last 2 or 3 years, we've been significantly cutting different programs and trying to divert the resources towards the frontline providers, paramedics, EMTs, dispatchers, call takers, to make sure that we're building the resources that are necessary. But the cost impacts that we've seen and the revenue impacts the other way are very difficult to overcome. And then as we work forward, the systems have to be redesigned to, as we've talked about, based on the science. And the days are gone where, hey, if you call 911, you're going to get an ambulance in 5 minutes. We've done such a good job teaching people to call 911. We answered 180,000 calls last year. And that's a really busy system. So, and response times are not a quality metric. It's just, they're easy to measure, so a lot of times people grab a hold of them and they want to talk about response times. But
Well, I think the general public, when you talk about response time from EMT, they're thinking it's an emergency. So if somebody's having a heart attack, response time is absolutely something you want to measure because minutes, seconds matter.
They're one of the things, yes,
That's
sir.
right. So to me, the critical thing is how do you weed out this 75%?
So we do that through our emergency medical dispatch process that I was talking about earlier.
To me, it shouldn't even, if you call 911 and it's not an emergency, then to me, it shouldn't even come to you guys. It should be filtered off to a whole nother organization, another group. So in other words, don't even waste your all's time with it.
The problem is there is no other group. EMS is being tasked to solve a problem that's not really ours to solve.
Yeah.
There is no solution, so have to be creative how we address that.
Yeah.
And it will take community, and community I mean nonprofit organizations, mental health organizations, sort of all coming together. Because in some ways you're right that we shouldn't have to deal with it. In other ways, I can also sort of see a large call center that has a multidisciplined approach and representatives from different organizations in it to be able to send the calls off to people that are better equipped to handle it.
So do y'all track, let's say, frequent callers?
Yes, sir.
And how do y'all handle those?
We typically send single providers out to see them. Again, a lot of times it's social issues. And by social issues, I mean they want somewhere cool to be. They don't understand. And so we have mobile integrated healthcare providers that go out and say, hey, you've called 911 3 times in the last 2 days. So tell me a little bit about what's going on and see if they can kind of get to the root cause and figure out how to fix that. We've put air conditioners in people's houses, heaters, things like that, and have been pretty effective at reducing the 911 calls.
How's this going to affect the fire department? Are they going to be sitting waiting for you guys for a long time, or how's that going to work?
So the first answer to that I want to give is nothing's changing with regard to the amount of resources that we put in the system. We do want to triage and make sure the life-threatening calls get to first. The point that you're talking about is we look at different responses, response plans. Those are things that we talk about, and we're going to have to talk about what that looks like and what the responses look like. So
I volunteered on an ambulance for 10 years, and I know exactly where you're coming from.
Okay. So, yeah, and in Saginaw, for their citizens, they respond to all the calls, and so that is certainly a concern. Because if we were to end up going to a model where there's really the constipations and things like that, either got a nurse triage we've actually done before, and we just cleared the fire truck would clear themselves off scene. But if we sent a single provider out, we just have to work through that. And again, we really do have a good working group that involves not just the people in the system and the first responders in the system, but we've got representatives like JPS's COO is on the board, UNT Health Science Center is on the board. So what they bring is some community resources to help deal with those low acuity calls and some expertise in those areas.
So in your thing, so if I call 911 and you all show up to my house, I'm assuming I'm getting charged for that. Or do I not get charged unless you take me to the hospital?
It depends on what we do. So if we do some sort of intervention, like even 12, what we call 12 lead EKGs, a more in-depth picture of your heart, you'll probably get a $500 bill for that. Again, we're a safety net provider. So if a lot of our patients are below the poverty level, we wrote off $26 million in charges 2 years ago. Because if you don't have anything, you aren't going to pay your bill, and I can charge you whatever. We collect about 2% of all the self-pay charges that we bill.
Okay.
So,
Do you get many people that subscribe to the subscription service that you guys have?
do we get
The
money?
annual program?
Star Saver.
Yes. The Star Saver, yes. I mean, the Star Saver program people pay into, and we bill the insurance, and whatever the insurance doesn't pay, we write off. If it's an absolute case of abuse, we have conversations with them to address that. To be honest with you, I can't think of one that has happened with that I can recall. But yeah, the $69 a year, that's how that works.
Do you have a lot of people doing it, or is it something we need to promote? Every
May we come around, we talk about it.
Promote
Yep.
is what I was
going to say. It's It really is. It's a good program because honestly, an ambulance bill, the gross charges on that are somewhere between $2,000 and $2,500.
The challenge, most people aren't anticipating an emergency.
Right.
And most people have insurance and think they're going to take care of it. But there's actually insurance plans out there now that won't cover your ambulance ride whatsoever.
They're excluding.
So people are uneducated about what kind of coverage they have and what it really takes.
Mm-hmm. So, yes, ma'am.
So what physical area do you service? All of Tarrant County or just parts of Fort Worth? And
So we are, we're a governmental authority, and what happened in 1988, 14 cities in the city of Fort Worth got together and they created us. They created MedStar. So you all are actually part owners in us, and we service those 14 areas plus Fort Worth, the city limits. So as the city limits grow, our service area grows.
and that's just surrounding areas?
They're basically contiguous
from
with Fort Worth. Yes, ma'am.
What can we do to help?
Ask any questions you have. We will continue providing updates. Chief Spears was nice enough to set aside some time and ask me to come present. If you have any questions, feel free to reach out. Chief Spears knows how to get a hold of me. I'm happy to give you my contact information. The biggest thing right now is we just want you to have awareness, and we want you to have awareness that it isn't a MedStar thing. It isn't just a Saginaw thing. It is a national problem that I've never seen anything like this. It's scary in some ways. It's also exciting in others because we have the opportunity to make some positive changes.
It would be fair to say our structure and the way we operate today cannot continue into the future. As he said, we're operating in a deficit the last couple of years, so we can't continue that way. So
there's data that we know. We know our population's getting older because of the baby boomers, and we know that the next generations coming up are a lot less than that generation. So it's not going to get better. It's not going to get better, and because of that, these people coming in here, they kind of get a little bit better to pick as to what profession they go in, because again, you've got that older generation retiring. Mm-hmm. So how far can you kick the can down the road?
To Chief Spears' point, it's not what you see today here in Dallas, anywhere else, is not the fix for tomorrow.
I know that. That's why I'm sitting here. That's why I'm trying to.
You can't kick. We're there. I'm telling you, we're burning $2 to $4 million of reserves a year just to maintain.
So, I look at the little bit of changes you got here. Those are tweaks. I don't see that being able to actually fix the system, per se, unless you really do the thing. So, is your organization making those changes? Are we looking at revamping our 911 system right now to be able to divert that traffic off?
Almost anything he does, though, to try to divert that leaves an open door for litigation.
Well, yes, it does that. There are some safeguards in place, but to answer your question, yes, that's what we're actively working through. The fact that I'm here having the conversation in front of you all is an indicator how serious the board and the fire chiefs take this. Our first step was doing the reprioritization. I am not standing here in front of you telling you that unless the federal and state governments decide to do rate increases to help buoy this and make us more competitive with the industries that you're talking about, that it's going to save it. That it's going to require national intervention, state intervention, to get anywhere close to the system that we've enjoyed since 2008 that supports itself. In the intermediate, what we can do is try to triage off some of those calls. And so if we're talking about having to help support the system to deal with the 911 calls that we're having, that we're required when people call 911 to provide some sort of response to, finding more cost-effective ways to do that to decrease the amount that's needed to help support. But there's not, without big changes, and they have to be big, and community, federal, state involved changes, it's not going to help it. And, fire chiefs are trained to be that calm voice when the house is literally burning down. Yeah. And over the last 6 months, even some of the fire chiefs that have EMS services have been like, this is getting to be a problem. It's, you know.
Some of those people that you want to sit to a triage, can they not sign up for to help? I mean, there's got to be something that they can do.
They don't have they don't have the funds to. A lot of them don't have. They don't have the dollars to actually purchase the subscription, or they don't mind not paying because they don't have the credit. In some cases,
And historically, there's always been the safety net. You call, somebody's showing up. It's
Yes.
embedded. We've done a great job with 911. Everybody knows you call 911 if somebody is showing up, not registering the cost of that and the impact that it has. It's going to take quite a while, and we all have to educate folks on kind of where we're at.
And even then, it's finding places for some of those folks to go. So working with the healthcare community, we're fortunate in the greater Fort Worth area. Because I came from Georgia, and finding places to divert folks to was a challenge. And
Anybody that's had the experience of calling and try to get a doctor's appointment, they ask your name and then what's your insurance information. If you have no insurance, you really don't have any other avenues, and it's 911. That's who gets it ultimately.
I didn't know if there was a program that maybe they could afford it. You know what I'm saying? If there was some kind of something that
No.
some kind of entity that could help them do that.
We've even pushed out, and I think you all did too, some of the links to when they opened or expanded the Affordable Care Act and things like that to try to. But again, a lot of people don't think about that. You know, even giving everybody the benefit of the doubt, they worry about going to work, doing whatever they're doing on a daily basis. They don't necessarily think about signing up for insurance because they're trying to make ends meet, right?
Are any other questions for Ken? We've been going this a while, and I want to move on, but I don't want to cut anybody else off from any other important questions.
Yeah, I have one.
Sure.
So, you know, we've talked about all kinds of things, but one thing we haven't touched on is how is this affecting the mental health of your staff?
So we have a lot of programs in place to help with the mental health of our staff. By and large, it's typically the things that you would think of that tends to bother them. Of course, the more acute calls, especially with children. And so we have intervention teams. We have a Hope Squad, for example, and then we also have professional help. Hope Squad's a peer support group. And then we have professional agencies. There's 2 or 3 of them that we use essentially for ERP or EAP support. So trying to make sure that's met.
Has it gotten worse over the last few years?
I think
just because of the lack of staffing?
I think across the country it's gotten worse over the last few years. COVID was a big challenge with people, and you know, and then folks coming up are not used to seeing some of the things that they see, in dealing with some of the things that they deal with, and times have changed. And
you could apply that to all public safety.
I was going to say some older folks were taught to suck it up and deal with it. Now it's more acceptable to kind of work through it. I'm not saying that was the right way to do it, because that had plenty of bad issues that came from it. But now people are more open about, hey, I'm having issues with this, and so we try to get them the help for that.
All right, thank you, sir.
Thank you all for
Appreciate
your time.
It. Okay. All right, moving on to a much more joyous subject. Item number 8, Animal Adoption Appreciation. And we have Dr. Michael Moats. Come on up, sir. I think you got a friend with you.
I do. This is Daisy. All right. Heard her rattling around her. Yeah, and she's going to have to go potty after my presentation. All right, so I'll be quick. My name is Michael Moats. I moved to Saginaw in 2000. Back then, we didn't even have a Walmart in this city. We had the silos, and if you were stuck at the trains, there was no little overpass to go over. You were stuck for 20 minutes, and that was that. So the city has grown since I moved here. In 2000, I was a student at Prairie Vista Middle. Graduated from Boswell, went to Boswell, Saginaw, and Hollenstein on my senior year. ROTC at one school, Career Center at the other, and that's kind of where we were. I had been trying to adopt a dog since November, and let me tell you, there are no, in my experience outside of the city here, there are not a lot of honest places. I looked at some Fosters, I went to Grapevine, found a dog that I loved online. Ended up being that the dog had a out of socket joint. They didn't tell me till after I met the dog. tried to adopt a dog from a foster. The foster adopted out from under me, so some pretty bad experiences. I don't know why I didn't think of the animal shelter first, but, was just Googling. This is going to be the fun part of the joking with the constipation thing here. When I came to the Saginaw Animal Shelter, I was told she has heartworms. She's probably going to pee on you because she's going to be nervous. She's going to poop in the house. And I said, all right, I'm taking her home. Let's go. And I did. And she went to the vet, got checked out. She's on heartworm treatment. She has a driver's license now. So we went to PetSmart, took a little picture on the little screen. They printed out her driver's license, and now she's a person. So I guess I'm here today really to point out that, I think that sometimes saying the truth, even if it's difficult, is better than not being honest. When I walked into the animal shelter, they told me the truth. We're also very fortunate that in Texas they have laws that require, the spay, the shots, everything, and for a really reasonable rate. I think I walked out of there paying $50, and she was set for the next year. Her heartworm treatment was covered, and so I just am here to be grateful today and say thank you. Next week, Daisy and I, we've ordered a bucket. We'll be taking some toys and stuff up to the animal shelter, so I'll be coming up there mid-next week. And yeah. And then also, while I'm here really quick, I just want to point out also that we have a great school district here. And I want to say, acknowledge really quick that with the MedStar stuff going on too, that, we had a shooting yesterday in Arlington at the Lamar High School. And so we're very fortunate. I'm a clinical psychologist, so it sounds like in those fields we need a lot of social workers, which would be very helpful in cases where EMS and some of those other things are not easily accessible. But I didn't come here to talk about that. I came here to show Daisy and say thank you. So that's it. I just wanted to say thank you, and honesty from there was very refreshing. I would rather take a dog home that I knew had heartworms, that I knew was going to probably throw up, that I knew was going to pee, because at least I know what I was getting myself into. And so, thank you. All right, say bye.
So I have a question for you.
All right, Colin. Let's go.
I had a question.
He has a question, sir.
Oh, he has a question?
Yeah, if you don't mind. So, what could we do? So when you originally started looking for your new pal there, you didn't come to the animal shelter first. What could we do to change that? What would have been different? What could we have done to made the animal shelter? You say, well, I want a new pal. I need to go to the animal shelter.
I think that, for me, I work from home, so I'm sure they have that, and I just didn't see it. But the outreach for me, like I said, I'm a clinical psychologist, so I work from home. I do telehealth. When I go out, but very seldom am I in the trenches. The majority of the stuff that I do in the community is in the EMS ISD. My mom volunteers at the board of trustees. I do a lot of that stuff. But I think just being aware that they're there. Signs, maybe. There's that big sign when you come into the city, just adoption days. They're doing some of that. I know that when I was up there, they said they're going to have a big snow cone thing, and they were doing a shot day or something like that. Just being aware. I think when I Googled, on Pet Finder, that's how I found the animal shelter. So, yeah. Any other questions?
Appreciate it.
Yep. Y'all have a good one.
Thank you, Michael. All right, let's go. Item number 9, consideration and action regarding award of contract for 2023 annual mowing contract. For that, Director of Public Works, Randy Newsom.
This is an item I wish I had to bring to y'all every year, but the last few years I've had to because our contractors that we've had just didn't quite fit the bill. We've learned something about them. They tend to, even though they have stellar references and resumes, equipment, they tend to cater to commercial folks, and then the municipalities are second. This company that we got the bid from this time is SRH Landscapes out of Dallas. They cater to municipalities. That's their cup of tea. And they have reached out to me before we even turned that first bids. They bid the first round. The rest of them that bid didn't bid it right. We bid this per cycles,
instead of a lump sum this time. We split it to do parks and facility right-of-ways, city facilities and right-of-ways, hoping that if we needed to get 2 different contractors, if it was too big, in the past, maybe it worked that way. It still didn't draw any more interest than we got in the past. So the company that was low bid this time was SRH Landscapes on both the parks and the city facilities and right-of-ways. They have shown the interest. They want to make the city happy. They want to get the 2-year extension at the end, which is in the contract. We've actually, this is approved tonight. They already called, set a meeting up Thursday at 9 o'clock. They want to know what are the things that have caused us problems in the past. We're going to give them a list, priority list, namely the flower beds and things like that. So staff would like to request that the council approve this contract, this bid to SHR Landscapes as presented in the packet.
Any questions for Randy? If not, I'll entertain a motion.
Mayor, I move that we approve the award for the contract for the 2023 annual mowing.
I'll second.
Okay. Please cast your votes. Motion passes. Thank you, Randy. Good luck.
Get to mowing.
All right, item number 10, consideration action on ordinance 2023-12, authorizing the issuance of sale of City of Saginaw Takes the General Obligation Bonds, Series 2023. For this, we got Kim Quinn and special guest.
Thank you, Mayor and City Council. We've got the results of the bond sale from today, and for that, Mark McCliney, our financial advisor, is here to go over that with you. And also Clark Kimball is here, our bond counsel, if you have any questions for him.
Hello, Mayor, Council.
Welcome.
And thank you, Kim and Gabe. Back in February, we were here, and you all authorized us to go out for bid for the general obligation bonds in an amount of $16,950,000. That was going to be $12,950,000 for streets and roads and $4 million for the balance of the park program. This is our third set of bonds that we've sold since the voters authorized them in 2021. With your all's permission, we went and got the official statement, put that together, worked with Clark, putting together all the disclosure items that we have to do, and we went to Standard & Poor's. Gabe and Kim are great ambassadors for the city. They do a great job of communicating our strengths and finance position, and we came back with the AA rating. And that's where we were, that's where we want to be. Your strength, your guidance on keeping the funds strong, what you've done, managed your tax rate, managed your operations, is exactly what they want to see. And Saginaw's AA rating remains extremely well and strong and good, and that's where we want it to be. That rating drives interest on bidding. So at your packet, you'll see or at your dais, you'll see a packet that looks like this on the front page. So at 11 o'clock today, we're accepting bids, or that's when the bids closed. We ended up with 11 bids, which is a lot. Anytime we get more than 5, we're saying bonds are in demand. Also point out that they came from all throughout the country. And you've heard me talk about that before. We don't want just Texas firms buying. We want them coming from throughout the country and competing against one another. The more we can get competition, the lower the interest rate's going to be. So just to give you an idea, the winning bid, 3.70%, is Key Bank. They bid out of Cleveland, Ohio. J.P. Morgan bid out of New York, Hilltop out of Dallas, Mesero out of Chicago, BOK out of Dallas, Raymond James, Memphis, Robert W. Baird, Milwaukee, TD Securities out of New York, PNC out of Philadelphia, Bancroft out of Fort Washington, Pennsylvania, and the Baker Group out of Oklahoma City, Oklahoma. So great exposure. And that's what we want. We want lots of interest. And so these results are what we're wanting. And so the low bid being KeyBank is who we would recommend authorizing. Now, what's this 3.7% rate look like? I wish it was a year ago. The Fed has started raising rates. You've all been paying attention to this. We knew that was going to happen when you voted these bonds back in 2021. Rates were incredibly low for a long time, about a decade, and we knew this. We put in our projections at the time at 5%. So this 370 is helping us maintain a tax rate lower than what we promoted to the voters back in 2021. At that time, we were expecting all of the bonds to take a 13.3% tax rate increase. Right now, we can finish the program with a total of 10 cents. So it actually less than 10 cents. So we're on target of keeping this all in. This bond issue is based off of what we're projecting for taxable values is basically another 2 cents. If you go forward in 24 or 25, which the balance of the bonds, the last set, it would be about another 2 cents. All in, we're thinking it would be under the 10 cents. As I said, that does not even count what you've done on the M&O side where you've lowered that another penny. So when we were talking to the voters in 21, we were thinking total of 13.3. It's going to look like it's going to be closer to 8 cents total after the 1 cent drop in the M&O side. Now, we don't know what's going to happen when you sell the next set a year or two from now. That's going to be, at your all's direction. But it's something that I really wanted to point out. We're doing much better than what we projected to the voters. And that's really what was the goal from, I'm sure, the council, but the staff and us. We always want to, the last thing we want to say is it's going to be 10 cents and then come back to your citizens and say it's 13. And we think we've done you all a disservice and hurt the trust that you all work on with your citizens. So all in all, it was a terrific sale. We were a big beneficiary of what you've been reading about in the newspapers the last couple of weeks on the bank. About a month ago, the 10-year Treasury bond was above 4%. People got scared with those two banks, one in California, one in New York, that failed. So they took money out and said, we're going to put it in riskless deals and put it in treasuries. And that drove the 10-year Treasury bond from over 4 down to about a 340. As the banks are getting this thing worked out and the federal government's working with them, interest rates have already started climbing back up. The 10-year Treasuries bond is at 360 today. My crystal ball is not great, but with inflation, we think there's going to be another Fed raise again tomorrow. I think it's going to continue until inflation gets under control, which it is not, which would drive our borrowing costs up higher if we wouldn't have been kind of that perfect storm for us getting it done and bidding while the little problem is with the banks. So we're happy about that for us. We still got lots of interest throughout the country. Very happy with it. And so our recommendation is to award to KeyBank Capital Markets. And I'm happy to address, I know you have more information at your desk, another packet. I didn't want to go into all of that because of, already been here for a while, and I wanted to get to the important parts, but I'm happy to go into any details that you might have.
All right, questions for Mark? Yeah, this is very good news, Mark. I wasn't sure what we're going to get, so
I was seeing things over the last week, but 2 and 3 weeks ago, I knew we weren't going to be pushing the 5% where we ran numbers, but I would have been guessing above 4%.
That's a great outcome, and I'm really proud of our bond rating as well. We're able to maintain that AA rating. That says a lot about how we manage our finances. So, council, questions for Mark? Thank you, sir.
Thank you.
Appreciate it. All right, folks, I'll entertain a motion.
Mayor, I make a motion that we approve the ordinance 2023-12 authorizing KeyBank as presented.
Charlie second. Please cast your votes. Motion passes. Thank you, guys. Thanks, Kim. Thanks, Mark. Appreciate it, y'all.
Thank you, Mayor.
Great work.
And again, Gabe and Kim really are great ambassadors for the city.
Good news. All right, moving forward, we're on item number 11. Here's consideration and action regarding recommendation from Planning and Zoning Commission on final plat for 18.532 acres out of Block A, Lot 1, Belt Mill, et cetera, et cetera. Who's going to talk about that? Salvador? Welcome,
Yes.
sir.
Hello. Good afternoon, Mr. Mayor and Council. Actually, so we've taken under consideration of the advisement from legal and the developers. This first item is going to be the plat for the development, the Belt Mill Villas development. They have some pertinent agreements that they're working on. So they're working on delivering those to us. We got it pretty close tonight, but we were off the clock by a little bit. So I would ask for the actual plat to be tabled for the April 4th council meeting, and we'll come back with that as well as a maintenance agreement. So the site plan is good to go. If y'all want, if y'all have any questions over that, I will try to address them.
Let's do it one at a time. So final plat, item 11 needs to be tabled.
That's right.
All right, so first, I'll entertain a motion to table item number 11, please.
Mayor, make a motion that we table item 11 as presented.
Pro Tem, do I have a second? Nikki, please cast your votes. All right, that's 11. Now moving forward, item number 12, considering action regarding recommendation from Planning and Zoning Commission on the site plan for the same piece of property.
That's
So,
right.
Go ahead.
Once again, so if y'all have any questions, I will try to address them. They were supposed to be here. It's not their fault. We've had some back and forth, like I said, on those agreements. Just trying to get the right timing can sometimes be a little bit difficult. But like I mentioned, for the April 4th council meeting, everything should be good to go, and we will bring the agreement and the actual plat for action on that council date.
Mayor, Mr. Mayor. Yes.
Correct.
Plan's good, right?
So site plan's good to go. Bryn might explain, it's much like platting, it's a formality. The reason we can't take action on the plat is there's a missing drainage easement that they had thought they would have finalized. The site plan, since they've submitted it and it meets our subdivision requirements, has to be approved, so.
Right, so if you'd like to take them both up at the same meeting, you could certainly table it, but the site plan isn't, just for clarification, it's not a second bite at the apple with respect to discretion for zoning. The site plan review is essentially a review by staff and council to determine whether or not what has been submitted to you, that level of detail, is compliant with the zoning that you've already approved. So if multifamily is what zoning is, if the site plan that's presented is a multifamily structure, it's required to be approved. Obviously, if it's a warehouse or something like that, then you have the discretion to deny it, but it's not, you don't have the full unbridled discretion that you do with zoning. The zoning's already been approved, and this is a sort of a public viewing of what it's going to look like, but approval of it is ministerial if it is compliant with the zoning.
Sure. Can we put that site plan on the screen, please? Just take a look at it. We've got it on our screens, but I don't want everybody to be able to see it.
And just to add on to that, the site plan has gone to the Development Review Committee. They've taken a look at it, and they have had conversations with the developer to make sure that that site plan meets all the requirements in our ordinances.
There we go. So that's what we're talking about. This is Belt Mill. This is site
That's
plan.
right.
This is
Belt
what
Mill
we're doing.
Villas. This will be part of the overall larger Belt Mill development.
And so the one final thing on 11 would not have any impact on the site plan, the drainage you're talking about.
No, the site plan is separate from the platting, and they can't permit without having it platted. So they're two separate issues. But both, as Brent explained, formalities, when they meet our subdivision requirements, they have to be approved.
And you're not waiving anything with respect to drainage by considering the site plan.
That's what I want to make sure.
You're not waiving anything.
You guys have got me way out of my wheelhouse on things like this, so.
Understood.
Council, any questions for Salvador? Or any other questions for anyone else on this site plan? If no other questions, I will entertain a motion on item number 12.
Mayor, I make a motion that we approve the site plan for the 18.532 acres in the Belt Mill Villas.
Okay. Thank you, Mary. Have a second? Paul, second. Please cast your votes. Thank you, guys. Thanks, Salvador.
See y'all next month.
Yeah. We look forward to the next time. All right. And that concludes our regular agenda. We will exit now for executive session. Pursuant to Texas Government Code 551.074 personnel matters, we will return to adjourn. Thank you.
Sign your life away.
There's more to be signed, down to be signed this evening. Just want to get these done so we can get the underwriter what they need. Yes, sir. Thank you. This is just so the underwriter has something they can send out their tickets on saying, yep, we got the new bid. Thank y'all.
Yeah.
This is, I think, okay. Very impressive. Vote Appreciate that. You too. Oh, yeah. I don't know. There's parts of it that I'm also like not So,
freezing in
It's
here.
cold out here, it's hot in here.
I know. Y'all hurry up.
What is the deal?
Okay.
We got Janice though?
I make a motion that we
All right,
adjourn.
At 7:56, we're back in back from executive session. I'll take a motion to adjourn.
I make a motion that we adjourn.
Valerie, Charlie, all those in favor? We have a quorum. We're out of here at 7:57. Thank y'all.